Hello, my name is Michael Dion, and I'm giving a presentation on nootropics and cognitive enhancement. Nootropics are smart drugs being touted in the U.S. as enhancing our ability to think, and they're actually being used quite a bit by academics and professionals. This has the growth of use has been monumental in academic settings. There definitely demand globally to reach billions by 2025. It definitely raises ethical and safety concerns. The term nootropics, first coined by Dr. Guerrera in 1972, they're basically substances that enhance cognition and they maximize the brain potential. They improve memory, attention, learning, and executive functions. They include prescription medications and over-the-counter supplements. Primary mechanisms are the modulation of the neurotransmitter pathways. Most popular of these nootropics are over the prescription, like modafinil, armodafinil, and some of them even have amphetamine mixtures in this. Effects vary based on individual and substance type. Um, for one, full disclosure, take modafinil. It's originally indicated for people with shift disorder and narcolepsy related to that. And I had a difficult time sleeping, and my understanding, it is a medication that has a potential to be abused. And I live in the Bay Area in San Francisco, and many of the people who do the startups, I understand, are taking very, very high doses of this to maximize their cognitive functions and their brain potential. So I was really surprised to hear this, and this is basically why I was picked this as a topic that I wanted to talk about. It's fairly new, and we're not sure of the long-term impact on healthy individuals. So it was something interesting to look into. Um, Prevalence and patterns of use. We noticed that there is university students anywhere from 1.3 to 33%. Those are the ones that have just reported it, and they grow more and more every day. Higher usage among medical pharmacy students, and people are basically hear about it from their friends, or they see it on the internet, or they see a movie called Limitless. And these are different areas where people feel like they can ramp up and be better at what they do. Um, they also see males show a higher usage rates than females. Peak usage is during academic stress periods, so end of the quarter or semester, where people need to really uh, be able to concentrate and do really well. There's a definitely variation in prevalence by country and study method, but there's a growing trend of online purchases and accessibility. Um, the interesting part, coming from myself, is when you are well rested and you do take it, I feel very sharp and very focused, and it just allows me to really take in all the information without interruption, and I feel like I'm working at a very high level. For those who are know about getting into the zone and how to get there, it definitely is a way of getting to a peak efficiency for studying, and allows you to stay there for a long time. 4 to 6 hours is what I've seen, although it's supposed to be used for people who work at night and you take it right before you go to work. Um, U.S. prevalence and epidemiology definitely continue. University students, as you know, a lot of pressure on them. Um, and lifetime prevalence is quite high, up to 43%. And these are in studies, 1 or 2 years ago. There are papers that come out a few years ago that show an increase from 25 to 2019. A lot of these are shown for prescriptions. And now there's a lot of nootropics that are available on Amazon. Um, and just typing in the word brings up all kinds of different ones you can buy over the counter now. And people can take them. Obviously, you don't know the quality of them on some of the sites, so you do wonder, like, it can't be healthy to ramp up your body and your mind every day like that without any significant consequences. And we're not quite sure what they are right now. Risk factors in vulnerable populations, of course, university students, particularly in competitive courses. I suspect those students who are at um, the larger Ivy League schools, or you see those in med school, or even students like us in the nurse practitioner program want to be um, very good at what we do and remember everything we read. So I think anytime a person feels stress and they see a way to increase their ability, I'm sure they reach out to it. So I'm sure a lot of it is unreported on how many people do use it. So it is sort of the interesting but scary part of it. Um, Academic pressure is the primary driver of this. Um, Gender differences, like I explained earlier, were reported. The men tend to do more of the using than the female, and I'm not quite sure of why that is. The course of study influences the likelihood of use. So basically, access to substances affect usage patterns. So if you can get more of it, you're going to use more of it. And if you have other studies or you have what you're studying is very difficult, you're going to use it more so you can really take advantage of that drug assisting you. Health effects and risks. They have both physical and psychological impacts. Short term, you can get the rebound of insomnia, anxiety, and cardiovascular effects, such as um, chest pain, hypertension, um, and even possibility of stroke. Um, we have long-term effects are still being studied, so we're not sure what that is, but I suspect if it's something to do with cardiovascular effects on the short term, long-term cardiovascular effects will follow traditional cardiovascular aging and risks. Um, there is definitely a concern that people are going to overdose and use it too much and cause strokes and heart attacks at a younger age. Assessments of abuse. Um, as a practitioner, you'll look for changes in sleep patterns and basically their mood and their behavior. They tend to be more irritated as it can cause a rebound effect in how you feel. Cardiovascular symptoms, increased blood pressure and tachycardia, and um, you will have psychological changes, anxiety, mood alterations. The development of tolerance and dependence is one thing that makes it a Schedule 4 under the DEA, controlled substances. So it is something that's not easy to get. I use a CPAP, and my provider, who's my respiratory nurse practitioner, she prescribes 1 month at a time, and it's difficult to get it reordered. So they definitely try to manage it in the ways. Um, the overdose risk that comes along with it, it is definitely something that needs to be maintained, because it's you build the tolerance and then all of a sudden you think you can take more and you don't realize, especially if you have heart disease, how much your body can take, and it could be very dangerous. So now we're going to go to the care plan, pharmacological treatment for nootropics. Um, you want to gradually reduce the dose when appropriate. Um, if they don't need it, start taking them off of it. Treatment of withdrawal symptoms if present, management of cardiovascular symptoms, monitoring of psychological symptoms. I suspect those of us who don't have a background in cardiology or as a general nurse practitioner would want to let the family practice handle a lot of these cardiovascular complications. But in our case, just identifying that the patient is on the medication is really important as far as a care plan, especially if they have a history of using it. They might not disclose it to you, but if you are ordering from, let's say, CVS Pharmacy or sending their prescriptions over to them, you can see all the scheduled medications that they've been prescribed, and you can see from there kind of what they've taken. Non-pharmacological approaches, stress management techniques, academic counseling, sleep hygiene improvement, alternative study strategies. I know for myself, doesn't matter. I've used to take one 200 milligram tablet, and even if I was tired, it really wouldn't work that well. So those who think that it's not exactly the modafinil is not quite like a caffeine pill where it will make you stay awake in that way. It works in a different manner where your cognitive functions are improved, but not necessarily like ramping up your body like caffeine does, if that makes sense. So those who see the best usage out of these medications are the ones who tend to go to bed early and wake up early, although that tends not to happen because they are using it for a reason to study more. But what they're really doing is staying awake longer, which defeats the purpose, or it decreases the efficacy of the medication. And then basically they need to reduce the stress as far as the courses that they're in, but that's difficult with some of them feeling that they have no other option to do that. The care plan, patient education, we talked a little bit about that, but basically there's, there are some immediate benefits, but we're not sure what the long-term effects are. There's some studies that are listed in my references that talk about what the effects of brain plasticity, the fact that it won't be able to be as easy to remember stuff when you get older because you are using your body in a way that's not natural. And we rely on that plasticity throughout life to learn new things. So we are trying to learn more now at expense of not being able to do that later in life is what some of the researchers have looked at long term. Recognition of dependence signs, and importance of regular academic support. Just basically seeing that they keep asking for it all the time, and you're doing an investigation to see how much they're sleeping, why do they still want it if the school semester is over, or what other reason are they doing it for. It just needs to be looked into it as another medication with withdrawal symptoms. So the care plan, as far as referrals, academic support services, mental health professionals, that's more us professionals, but you would also look at substance abuse specialists for those of us who are going to go into substance abuse. That would be something that you could refer to. Student health services. Basically, the assumption here is that a lot of the stuff, the people who are abusing it are students, and you want to help them decrease the academic workload in that aspect. But for us nursing practitioners, we want to look at it as another medication that we could help with either substance abuse or if they need more counseling, a mental health referral would be good as well. Care plan, the follow-up. So regular monitoring of cardiovascular status, doing blood pressures at home, sending them to you, assessment of academic performance, asking them, what part of their career they're in as far as their semesters, and how can they separate any of those classes into 2 semesters instead of one. Um, you know, developing alternative coping strategies as far as like maybe studying earlier for the exams or um, in other situations, maybe not waiting to the last minute. Um, those are easier said than done, but it's one of those, it's up to the patient to really want to change, and we just try to give them as much information as possible. And we do that by doing ongoing support, and we keep an eye on them. But we should, as more information comes out, try to give them as much up-to-date information and let them know what effects that medication has on its body. Conclusions, nootropics, they definitely work. They improve cognitive function. Um, we don't know what the long-term effects are, but for people with impaired functions, it definitely works for narcolepsy related to shift work disorder, which is what is the FDA is indicated for. Um, they are generally, well tolerated. They have minimal side effects at the appropriate doses, but they always they take some, and some is good and more is better, and that is not always the case on these. Um, they definitely have improved memory and the learning capacity. So it's hard to not to use it because it makes you better at what you do. And in this day of age, we are always striving to be the best all the time. Um, nootropics really require consistent long-term use, um, and you don't just take one and it works. So you have to be careful that you need a build-up of some of the medication in your body for it to start working, and then it's just that trickiness where you want to take too much, but you can't also just take it once and expect it to work. Um, so natural nootropics such as ginkgo biloba um, is available and has been available for a long time. Those who take it have had side effects such as their heart problems for a long time. Um, there's a lot of synthetic ones that have come out, like I mentioned, the armodafinil and modafinil, and then there's another one called pyricidum that is basically something that needs a prescription for. The armodafinil is a form that doesn't go into the active form until it goes into your blood, and it tends to last longer than the modafinil. Um, it's a very interesting drug that's out there because there's a lot high abuse of potential, but um, we sort of always want that extra edge. So as a provider, we want to ensure that we approach their use, and especially with our patients, to make sure that they're cautious and they're well informed on why they're using it. And as the field evolves with research and our understanding of these compounds, they just grow more sophisticated with each study. So it's more to follow. And I've included some of the references in here to if those want to read and follow up more about that. Thank you for your time.